my name is Paula Arenas, and today I'm going to be doing my validation video on a central line dressing change. So the first thing I'm going to do is stable in 7 steps. So check the physician's orders, then we wash our hands, we gather our equipment, we make sure we have the right patient, we introduce ourselves to the patient, we explain the procedure we're going to be doing to the patient, and we always provide for privacy. So the first thing I'm going to be doing is raising the bed to working height. Lower the side rail. Then I'm going to be assessing the patient's central line, make sure that there's no drainage, there's no wounds, that the skin is not red or any signs of infection. So then we're going to be opening up our package.
You could do their vaginal or penis area first, and then you can go back to the bathroom if you don't choose to do it. But that would be
So we want to instruct the patient not to touch any of our sterile equipments, and also to put their head towards the opposite side of where the central line dressing is. So we put on our mask.
But if you're walking away to change the water, is it okay to keep it in the bed in the out position?
And the reason why we ask the patient to move their head over to the side is because we don't have an extra mask for them to use. If we had an extra one, then we would put one on the patient. So now I want to put on my gloves. And I want to, since I already assessed this one, I want to be removing the dressing. So we want to make sure that we remove the sides first, and then the last thing we remove is the center. We also want to make sure that we are asking the patient for their comfort level, their pain level, if they feel any pain while we're doing this. Now we're going to be discarding our gloves. Okay, so now we want to make sure we put on our sterile gloves.
I make the kids clean them. Like I have them do their own stuff. I make them do their own dishes. And I have them do their laundry. No, I don't play that. Yeah, I don't play that. But I'm thinking about going back to an army. I'm thinking about going to be a nurse in the army. Like I let my kids play and make a mess, and after your mess is done, you gotta go fix it.
Now we grab our ChloraPrep, break it, and then we make sure that we rub and we use friction to clean the patient's skin.
You know what? It's like anything. If you don't use it, if you don't use it. Just remember that I just want to let go. All right, girls?
Yes, thank you.
Okay. See you next week. No, I'm not.
Ready?
Yeah.
So then we want to make sure that we clean the line.
I remember because on the 6th we're taking the head
And we'll
scan.
do it.
And our last day of clinic was May 1st. May 1st.
So now we want to make sure the patient's skin dries before we apply the next, the new dressing. It usually takes about a minute, or since there's a mannequin, it's going to take a little bit longer. So now we want to grab our dressing. want to make sure that we don't contaminate the dressing. Make sure all sides of it are taped down to the patient's skin. Then we want to remove this. Since this is the outer layer of the dressing, I can touch it with both hands. And I can take over gloves. And we always want to make sure that we put a label on it. So we put our initials, the time that the dressing was changed, and the date. And we want to make sure that we don't put it right on the center, so that we are able to assess the dressing and the wound. So now we put our side roulette before we take off our mask. Side roulette. Put the bed all the way down. Make sure that our patient is comfortable. Make sure that we leave the call bell by them so they can call us if they need anything. Cover them up. Make sure that they're comfortable, and then we make sure that we record everything that we found, the time and the date that we changed the dressing, and make sure everything is thrown out into the garbage.